For cardiovascular diseases, let me say a patient comes to the clinic. So you actually took the history of the patient. So after taking the history of the patient, you now did physical examination, all right? So you are kind of like 60% sure that this patient actually has a cardiovascular disease. But then you need to still follow up your findings with some other diagnostics modalities, so that I can now be 100% sure that okay, this patient actually has a cardiovascular disease. All right. Then you can now have evidence. You can have evidence, right? In case in the future, any law case or anything, you can have your evidence that actually this patient had a cardiovascular disease, also known as a lipid disorder. All right. So looking at the various examples of investigations that could be done for cardiovascular diseases, we have investigations like what? Fasting lipid profile. All right. So fasting lipid profile can be done. Then another investigation is what? Highly sensitive C-reactive protein. All right. Highly sensitive C-reactive protein. The next one is what? Non-invasive measures of atherosclerosis like what? Carotid intimal thickness in some cases. Then electrocardiogram, also known as what? ECG or EKG. So ECG is actually a quick and painless test to record the electrical signals in the heart. You could see this. Okay, so this is echo. This is ECG, where they place all those electrodes on you, and they get to pick the electrical activities of the heart. The next one is Holter monitoring. Another one is echocardiography. This is echocardiography. They use a probe, all right, and they get to see the heart chambers to see if the heart chambers are dilated or not. All right. Then exercise test and stress test. Probably can make you do one or two small exercise to see if you now be too stressed or you be struggling to breathe because you have done those exercises, right? So that's exercise test and stress test. Then cardiac catheterization. Then the next one is what? Heart or cardiac CT scan. Then they can also do what? A heart or cardiac MRI scan. That's what? Magnetic resonance imaging. All right. So you can see this is Holter monitoring. This is MRI scan. This is cardiac catheterization. This is stress test. When they will ask you to do some small jogging to see if you now be too stressed or so. Right. Then this is CT scan. This is various blood tests. All right. And when you're doing blood tests, you are trying to look at all those plasma cardiac markers or so, all right, to see if they are elevated to confirm that there is a cardiovascular disease condition. That's it.